Good afternoon, and thank you for joining us for American Medicine Today, brought to you by the Bonati Spine Institute. I'm Kimberly Brummel, alongside world-renowned orthopedic surgeon Dr. Alfred Bonati, Ethan Euchre, and Jeff Wagstaff. Previous to the break, we were hearing from patient Kelly Nelson of the Bonati Spine Institute. She was telling us about her relief after receiving a few cervical surgeries as well as lumbar surgeries with us at the Bonati Spine Institute, and how we were able to help her. The quick question we want to ask you now, Kelly, is before coming to us, did you seek out treatment elsewhere, and what were their ideas as to how to resolve your pain?
Well, to tell you the truth, I first went to you after doing my own research for 3 surgeries.
Okay.
Then when we had this terrible accident December 2nd, I was a little bit afraid to travel because I was in such pain and, knee replacement, all that. So I talked to a doctor here that allegedly did minimally invasive, and this neurosurgeon wanted to put cages and screws and a rod up my spine because I have scoliosis, which is curvature of the spine. And as you age, when you shrink and you have a curvature, you're even more susceptible to having problems with various discs. So this is what the man wanted to do. I actually ran out of that office. I thought there is no way that I'm going to allow anybody to do that to me. I have a very active life, and I did not want to even think about all that surgery and what the recovery would be, if there was even a recovery, because I know people that have been through that, and they have never recovered. So back to Bonati we went.
Well, I am so glad that we were able to help. And Kelly, real quick, how are you feeling now?
Well, I'm feeling great, but I have to tell you, again, this is because of Dr. Grossmith and Elaine, the nurse, who called me every week after this last surgery, and it's been 5 or 6 weeks now. It was March 31st. And Dr. Grossmith actually suggested that I have the left hip checked out because he thought the hip might be exacerbating pain in the back.
Got it.
So what did I do? I made an appointment with a hip doctor, and sure enough, he did an x-ray, and he didn't find anything broken or cracked or anything. But he said, you know what, you've got inflammation there and probably a little arthritis and some bursitis, and we're going to give you a shot of cortisone and see if that helps. And it did help. All the back pain's gone, and Dr. Grossmith was right. It was not from the back, it was from the hip.
Look at that.
Now I'm fine.
That's fantastic. So Dr. Grossmith not only fixed your back problems, but saw another potential problem, and you were able to get that fixed. So that's fantastic.
That's right.
Now, the other reason we wanted to speak to you, and we don't have to play the sounder unless you want to, but you had a lot of articles that were online, Kelly, and you're talking about troubles with insurance companies and problems with Obamacare, so we want to talk to you more in depth about that.
Well, yes, there are a lot of problems with insurance companies. We've all heard of how many people have lost their good insurance, and now they're having to pay exorbitant fees for the same kind of coverage they had before, and not even the same kind of coverage, lesser coverage. What happened with us, my husband is insured with Blue Cross Blue Shield. Now, I hate to mention names, but I'm going to have to. They started with a third party in Blue Cross that would decide whether you really needed the care that the doctor deemed necessary for your health. And this group is called Triad. Unfortunately, Triad likes to say no to everything. And had I gone to Bonati probably 2 to 4 years ago, I would not have run into this problem. Now, because of this third party, which has come about in many of the insurance companies, and there's a long time certification waiting to see if you can even have the surgery, if these people decide that they're going to allow you to have it. This is a problem today, especially for those of us that are over 60 or those of us that are on Medicare, because $500 billion has been cut out of Medicare, and now we are seeing some absolutely horrible things happening to the elderly with Medicare.
Yes.
Their minimal costs, co-pays of $5 or $10 have now skyrocketed to $150, $200 or more, and these people on limited incomes are unable to pay this. Thus, they don't get the care they need. And I think this is the whole point of Obamacare. They would like to see the elderly, who costs the insurance companies a lot more at the end of life, eliminated, and eliminated quickly. In fact, when Romney was running for president, he wanted to eliminate the death panels out of Obamacare, and he said, and I quote, "It puts in place an unelected board that's going to tell people ultimately what kind of treatments they can and can't have." Well, Obama answered this, and I quote him too, "This unelected board that we've created, what this is a group of healthcare experts, doctors, etc., to figure out how we can reduce the cost of care in the system overall." And then he continued to say the death panels would make, quote, "the cost of care more effective." Of course it would. Of course it would, because it would totally eliminate giving people the care they need at the end of life. And this even includes pacemakers that's going to give grandma or grandpa another 10 to 12 years to enjoy their grandchildren. Instead, no pacemaker, and you die within a year.
Jeez.
This is what's happened to America. It's already in England, and I have friends in England that tell me about it all the time. I had a friend over there that was going in for gallbladder surgery, and she wrote and she said, "Please pray for me because the hospitals here are so filthy that I'm afraid of what I'm going to come out with. Just pray I get through this."
Kelly?
So I think that's coming to America, because my local internist, I went to him and I said, "You know what? I called and ordered something, and the gal said they sent it, but they never did send it. And I'd like to know what happened." And he said, "Kelly, I want to tell you something. We are so inundated with paperwork because of Obamacare that I have to come in every morning an hour and a half early."
Hey, Kelly.
He said, "Not only that, we've got doctors quitting left and right.
Kelly?
We're all overwhelmed."
Kelly's on a roll.
Oh, Kelly?
Kelly, let me interrupt you there real quick. We actually have a guest coming up this next segment, but for our fourth segment with Dr. Bonati, we can get you back on if you want to finish your segment there. And Dr. Bonati, I know, wanted to chime in as well on this topic. So,
Do you have time to join us in the fourth
Sure.
segment?
Do you want me to hang up now, or?
I'll put you on hold, and we'll take care of you during the break, okay?
Thank you.
Okay.
Thank you, Kelly.
All right, hang on. Kimberly?
Okay, well, a lot of interesting talk here. Coming up after the break, we're going to be speaking with our friend, Dr. Christopher Moore, sports nutrition advisor for Men's Fitness, and he's going to be talking about how you can eat your way to happiness. You're listening to American Medicine Today on News Radio 970 WFLA. Stay tuned. Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.